Medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
There's a new Italian study on COVID vaccines, mortality, and cancer from Pescara many are talking about. What they did is tracked over 296,000 people for 30 months, comparing the unvaccinated 1 dose and the 3 or more dose groups. It claims vaccines cut all-cause mortality, but flags a slight cancer hospitalization bump hazard ratio 1.2 to 3 for those with at least 1 dose. But this study's got holes big enough to drive a truck through, and it downplays a darker reality about vaccine injuries, including rising reports of turbo cancers. The biases, well, they're glaring. Healthy vaccine bias is admitted but not qualified. Vaccinated folks are often healthier, skewing mortality results. Unmeasured factors like diet, genetics, or socioeconomic status, ignored. The cancer signals shaky to just a vague hospitalization metric with no breakdown by cancer type or stage, whether it's breast or prostate, no clue. And the risk only shows up in people without prior COVID injection, then vanishes with a 12-month lag. It's not science, it's statistical gymnastics with no explanation, just a shrug of the shoulders. Worse, the study glosses over vaccine harms entirely. Other sources are not so great. 223 study linked mRNA vaccines to myocarditis in young men with rates as high as 1 in 2,000 in some groups. Blood clotting issues like cerebral venous thrombosis in 2021 for AstraZeneca and Johnson & Johnson vaccines. Guillain-Barré being tied to vaccines in 2022 with rare but real cases. And then there's the turbo cancer phenomenon, anecdotal, but it's growing. And reports in 2024 and 2025 note aggressive cancers like glioblastomas and lymphomas spiking post-vaccination, especially in younger patients. Now, there's no clear causation yet, but the timing suspicious rapid onset cancers defy typical progression. And the study's misleading by omission. It buries cancer's signal weakness while ignoring the broader vaccine injury data. The mortality benefit is likely inflated by bias. The cancer risk underplayed and poorly defined. You're seeing patients with concern, maybe even unusual cases. Dig into your patients' vaccine histories. And how do you weigh these risks against the benefits when trust is on the line? Oh yes, one more thing. Today in Florida, Governor DeSantis and our great Surgeon General announced the elimination of all vaccine mandates for school children. Oh yeah.